All right, we're going to talk about phototherapy today. So for mother baby, most of our providers always order triple therapy. So that is going to include your overhead light and your Billy blanket. So you always want to make sure that you verify your provider's order for exactly what they've ordered. If it's triple, double, single. You also want to make sure and gather all your supplies. So like I said, our providers are most of the time going to order triple, and so that's going to include your light and your Billy blanket. So you're going to gather those two things, you're going to bring them to your patient's room. You're also going to want to make sure that you have the blanket cover, you have your eye protection for your baby, and you have your 2 flux meters. This flux meter in the green packaging that looks like this is specific for your Billy blanket. This Billy meter is specific for your overhead light. So you're going to have all your supplies. You're going to educate your mom, your parents, and tell them exactly what you're doing, why you're doing it, how it's important that they keep the baby under the lights as much as possible except for feedings or diaper changes. The longer the baby stays under the lights, the faster they're going to get to go home. So this Billy blanket, you can see right here, there are 6 dots. This is where you're going to take your flux. So on this blanket, you're going to do your flux at C and D. You're going to add those together, divide by 2. Your number should be greater than 60. So we'll actually do that here in just a second, and I'll show you. So we're going to put this cover on this blanket. Get it situated in the bed. These extra little ties right here, you can use them. You don't have to. Some people like to kind of wrap them around the baby. Some just leave them sitting. So once we get that on, we're going to turn it on and we're going to check our flux. So we're going to turn it on. We're going to take the cap off of this flux meter. Make sure it's on. You'll see your 0. You're going to do your C and D. You're going to push the little round button. It's going to give you a number. Then you're going to go to your D, you're going to push it again, get your number, you're going to add those together, divide by 2, it should be greater than 60. Then when we get our overhead light, we're going to make sure that our overhead light is 35 centimeters from the baby. Most of these are set where you need to be, but you can get your ruler and make sure that you are 35 centimeters. Right back here on the back, there is a double line and a single line. The single line is single phototherapy. The double line is double phototherapy. So if we're going to do triple, we want it on the 2 here, and then your Billy blanket is your 3rd. Here's your on-off switch. We're going to turn that on. And now we're going to do our flux for the overhead light. For this one, when you turn it on, you want this pretty much level of abdomen of the baby. You can wait until the baby's under here if you would like to, or you can just kind of range kind of exactly where your the level of abdomen is going to be for your baby. You're going to click it. I got 36.2. You want it to be greater than 30. Now we've got it set up. We're going to make sure that we've got our eye protection on our baby. This is super important that we make sure that this eye covering is secure on the baby at all times when they're underneath the light to protect their little eyes. That's a big education piece for parents as well, to make sure that this always stays on their baby. This top one just kind of wraps around the top of the head. This bottom one kind of wraps around the bottom. And you'll kind of see these Velcro pieces here where they attach to. You kind of want to look and make sure that there's not any light getting through. It's securely on the baby's face. And then you're going to put this baby under here. The other thing is you want to make sure the baby looks just like this. Diaper and mask only. No other clothes or anything on. Once they're under there, you want as much skin showing as possible. If you wanted to use these, you could wrap this around and secure baby this way just to help kind of keep them snuggled in there. Some babies get really fussy when you put them in here, so if parents are okay with a pacifier, you can give your baby a pacifier as well. And like I said, just educate your patients to make sure that they know that the baby needs to stay under the lights as much as possible. They can take them out to breastfeed or for diaper changes. When we have a baby under Billy lights, we want to also ensure that we are taking a temperature every 2 hours. They're not covered up. Our babies lose temperature really quickly. We want to make sure that they're holding their temperature okay. So vital signs every 4, but temperature every 2. We also want to make sure we document this under our phototherapy band and beacon.
Can you show the blanket again, the C and D spots, so that we can see that it is face up or face down?
So the C and D is face up.
Thank you.